Hello to all of our colleagues and partners of Gulf Coast Community Foundation. This is Lori Hubner. I am both an investment incredible consultant with Gulf Coast Community Foundation, as well as an independent consultant focusing on human resources. I am here today to share with you the content of our next webinar, which is all about returning to work and preparing to return to work. I think we all find ourselves in a unique and new situation. The workplaces that we were in just 6 to 8 weeks ago already has changed, and there are many new steps, new processes, practices, policies that we need to get in place to be able to allow our employees to return to work safely. And that is a lot about what this webinar is about. It is helping employees feel like they are returning to a work environment that their employer has prepared so that is as safe and healthy as it possibly can be. So this is the actually 5th human resource centric webinar that Gulf Coast Community Foundation has invested in. They are so focused on helping support our nonprofit organizations throughout this region to help navigate these really complicated waters that we find ourselves in. The other webinars, one was around the federal law alert with HR policy implications, best practices and policies for remote workforce. That was all about emergency telecommuting. Those 2 webinars are recorded and on the website. HR policies with COVID-19 impact was actually a live webinar, and that is also available on the Gulf Coast site. And employee engagement and productivity is coming soon. So today we thought it was important and really a priority to help our organizations think through all of the policies and practices to get in place to prepare for returning to work. Just going to review the agenda quickly. I'm going to touch on an occupational risk pyramid for COVID-19. We're going to talk about workplace safety. If as an organization you choose to have a COVID-19 screening program, what could that look like and what are some tips and clues? We continue, many of us, to work remotely. What are the pros and cons and advantages of that? How to achieve social distancing in the workplace. We are also sharing with you today an infectious disease policy and program, a policy around the Families First Coronavirus Relief Act, it's a mouthful, FFCRA, a policy with forms for your employees to request expanded FMLA leave time and emergency sick leave. And then toward the end of the webinar, I'll take a moment and review all the policies and forms and even a couple posters that we are posting on the Gulf Coast Community Foundation website. Think of it as a return to work toolkit for you to access at your convenience and to help you navigate this new type of work environment that we find ourselves in. So I'm going to dive right into the material, starting with a couple of caveats. This is not intended to be, and it does not constitute legal advice. I think it constitutes pretty good HR advice, but just to be clear, not a lawyer. So if you do ever feel like you need to seek legal advice, then absolutely you need to do so. Secondly, though, I wanted to be really clear that all of the content of this webinar, we're providing several return to work policies and tools. Every organization may apply these tools differently. You really have to think about the risk level of your organization. And so we are providing you with resources, with policies, with forms, but how and you choose to use those forms and policies are really going to depend on the risk of your organization. And that leads me into my first slide called Occupational Risk Period for COVID-19. I have to say, when I found this, I actually was excited because one of the challenges in preparing this webinar and thinking through all of the various options is that based on the risk level of your organization, what you choose to deploy in terms of tools and practices and policies could be very different. So this particular risk pyramid was developed by OSHA, and they categorize employers and workplaces from a very high risk, high, medium, and then lower risk. And so let's take a couple moments on the next slide, because I think this is really important for organizations to get their heads around. This might be something that you want to have a discussion with your board or with your leadership team about where does your organization fall in terms of risk for COVID-19. So let's talk a little bit about how OSHA defines these different categories. This first category is very high exposure risk. So these are jobs and workplaces that have a high potential for exposure to known or suspected sources of COVID-19 during typically specific medical, postmortem, or laboratory procedures. Some of the jobs or workers that would be in this category would be healthcare and morgue workers, collecting, handling specimens from potentially infectious patients, people working directly with people who either have or suspected to have COVID-19. That would be very high exposure risk. Now, obviously, what comes to mind in our region would be our hospitals, our medical offices, our labs, and so on and so forth. So that's very high exposure risk. And the practices they're going to put in place is going to be at the very top level of providing, personal protective equipment, requiring all kinds of face masks or gloves or other types of things in their workplace because of the level of their risk. The next category is high exposure. And so those are jobs with a high potential for exposure to known or suspected sources of COVID-19. So what would some examples be of jobs in this category? They would be healthcare delivery, healthcare support, medical transport, exposed to known or suspected COVID-19 patients, suspected, working, bringing, as a medical transport person, they might be moving people who either have or are suspected to have COVID-19. And workers in these categories, are also at very high risk to COVID-19. So you could imagine that organizations would have all of the personal protection equipment in place and so on. So let's talk now about the next category, which is medium exposure risk. And these are jobs that require frequent and close contact with people who might be infected, but they are not known or suspected patients, and they're not known carriers as well. So workers in this category could include anyone with contact on a regular, consistent basis with the general public. And examples would include schools, high population density work environments, some high volume retail settings like malls. You can picture manufacturing sites where there's a high density of employees in a production area. And those employees and jobs would be subject to a medium level of exposure. And then finally, how OSHA defines the lower exposure risk. These are jobs that generally do not require contact with people known to be or suspected of being infected, who might be high risk, who might be asymptomatic. And some examples of workers in this category, they have minimal contact with the public and minimal contact with other coworkers. I suspect that the majority of those of you listening to this webinar today fall within the medium exposure risk to the lower exposure risk. Quite candidly, if you are in one of the very high exposure risk or even high exposure risk organizations, you are already operating under a set of practices and protocols in your workplace that are above and beyond most of our other organizations. So I would suggest that you and your leadership team and possibly your board consider this risk level and have that help determine what policies and practices you decide to offer or to make required in your work environment. So let's touch base on what are some of those workplace safety guidelines you need to think about. So again, as I said very earlier on, is that employers want to and should make the workplace as safe and healthy as it possibly can be. I don't think any of us could ever 100% guarantee that the workplace is 100% safe, but we all need to take the proper steps to make it as safe as possible. So some of those guidelines to help assure employees that as an employer you are making their workplace safe. One could be a COVID-19 employee health screening procedures. And I highlighted that because I'm going to be spending a couple slides just on that alone. Certainly cleaning procedures and the ongoing supplies you need to disinfect and keep your workplace and your work environment safe for employees. Rather than recreate the CDC wheel, what I've provided here is a link to the CDC website, and they have just an excellent piece for organizations on how to disinfect and keep your buildings and your facilities appropriately clean, along with suggestions and guidelines about all of the types of supplies that you should be using to do so. Obviously, some other guidelines is to restrict business travel, to define some visitor contact protocols in terms of people visiting your work site, not even outside of your employees, but either those you serve, contractors, vendors, so on and so forth. And then always understanding and complying with OSHA rules. I'm going to spend a little more time about OSHA a little later as well. I was really pleased to see they came out with kind of an awesome set of guidelines for employers. As many of us might know, they've been very quiet through all this, but they're starting to come out with some really good material that I think our workplaces will find really helpful. So when you talk about workplace safety, what are some of those just basic infection prevention measures that you should market, communicate, whatever word you want to use? You want to make sure your employees know that these are the standards by which you want to hold them to. And some of these include promoting frequent and thorough hand washing, and also being sure that you supply the locations and the supplies and the tools and the soap and the disinfectants and so on, so that to facilitate employees being able to accomplish this. Encourage workers to stay home if they are sick. During this year, you do have the option of the expanded FMLA and the emergency sick leave options. And so encourage, even if you don't offer PTO or paid time off, there are ways that employees could be encouraged to stay home when they're sick. Certainly encourage respiratory etiquette. I think hopefully by this time we've all seen when you cough into your arm, and when you sneeze into your arm as well. I've read some statistics that have said that the sneeze actually produces much more droplets out of our mouths than a cough because it's, I guess, that much stronger. But regardless, if you cough, you sneeze, do it in your arm. Also provide visitors and anybody that might be visiting from the public with tissues and trash receptacles. Employers should continue to explore whether they can establish more formal long-term policies and practices, such as flexible work sites, that is telecommuting, flexible work hours, staggered shifts, and so on, to help increase the physical distance between employees. Also discourage workers from using other workers' phones, their desks, their offices, or other work tools and equipment wherever possible. Maintain your regular housekeeping and cleaning practices, and either allow or provide face masks. And I'm going to touch a little bit on face masks a little bit later, but again, this is part of your risk evaluation, whether or not you and your organization feels this is appropriate based on your risk level. So some organizations may want to put in place a health screening program and the procedures to go around that type of program. Many of you who know me know that I serve on a board locally, and we serve a very high-risk population. We are starting to return our participants to our location starting next week. And we are opting to put an employee health screening program because of the high risk nature of our participants. But that's a good example of where we've gone through the risk evaluation. We realize, we need to make sure that our employees are not going to pass along the virus to this high risk population. And so we're going to take the extra steps to do health screening. If your organization does choose to do health screening program, I believe one of the best practice things you could do right from the start is identify a program leader. You need to have someone in your organization accountable for this, and you need to give them the time and the resources to be able to put this program together, because there are several factors to consider if you want to move down the health screening program route. One, you need to truly understand the national and local, state and county mandates. They're all different. They are all different. So you need somebody who's going to do that research and understand exactly what that all is. You need that individual to develop a program and a plan. Who's responsible? Who in your organization is going to be subject to screening? Is it all employees? Is it only essential workers? Is it only non-essential workers? How are you going to do that? If you do screening, say for example, you want to do something like temperature taking, you need to think about the actual procedure and process and how you're going to operationalize that. Are you going to have employees line up at your front door every day and get their temperature taken, for example? You need to think through, what about employees who refuse to be screened? What is going to be your response to that situation? How are you going to keep this medical information confidential? Despite the fact that there is general agreement, employers can do temperature taking, truthfully, this is not really in alignment with many of the laws that have been passed over the last many years, including the Americans with Disabilities Act and HIPAA. And they still are expecting that despite taking temperatures, that is a medical type of evaluation, and you do need to keep that information confidential to that employee. And then training. You need to help train employees what to expect and communicate to the board, to your employees, to those you serve. If this is, for example, a program that you want to put in place for your organization, you're going to want to know those you serve know that you are taking these very safe steps. The example that I provided about the board that I serve on and the organization, we want our participants to know, we want their guardians and their families to know that we are being highly, highly careful about bringing them back into our environment. So that's a whole communication plan. You need to think through who are your constituents and who are your key stakeholders, and how do you make sure they're all aware of the steps that you're putting in place. And so because of that, this is why I truly believe having an actual program and a leader in your organization is the right step if you want to go down this health screening route. So a little bit more about employee health screening. Curious in a way, but Florida does not require, at least to date, that any employers have to health screen their employees as they enter their workplace, nor is there a requirement for face masks in the workplace. So Florida is leaving it up to employers to make those kinds of decisions. I looked at all of the states across the United States in terms of their requirements, and I would say about 30 or 40% are requiring health screening as employees enter the workplace, and some of them are requiring face masks. So because there are so many different practices and regulations out there, you're going to read and hear all kinds of different things. But leave this webinar knowing that it's not required by Florida, and it's optional for you as an organization, whether you want to put these practices in place. The common health screens are temperature taking, which is both popular and controversial, and I'll spend a moment on that. documenting daily temperatures plus observations of respiratory illness. So this is where someone that's part of your program, it could be the leader of the program, is actually documenting a temperature on a daily basis for an employee and noting observations about whether they think that employee is demonstrating signs of a respiratory illness. And then there's also a practice to require employees to certify their health status upon returning to work after any illness. I will say, I think that's a good practice. And later on, I'll show you that we have a form to help facilitate that for your organizations. But I want to take a moment and go back to temperature taking, because I think there's an awful lot in the media and the news about temperature taking right now. And so it's popular and it's controversial. Why is it popular? Because it sounds pretty easy to do. You get a handheld device and you don't have to, you know, like the old fashioned, put a thermometer in someone's mouth. You hold up this handheld device, you know, about 6 inches from someone's forehead, and it takes their temperature. So how easy is that, right? Well, then you start thinking about some of the implications. Number one, because an employee has a temperature does not mean they have COVID. It does not mean that at all. It could be a whole host of other things. Second area of that could be controversial. Who in your organization is going to take the temperatures, and how are you going to protect them from possibly being in front of people who are asymptomatic with COVID or have COVID actively? So you're going to have to ask someone on your staff to be the ones to take the temperature and to document it. There's also some other controversial bits. I mean, earlier on I mentioned, are you going to line your employees up? But you have to think through, how would you operationalize temperature taking? So, you know, for example, do you have all the employees report to a conference room before they actually go into work, and you line them up and you take their temperatures? Well, then you're going to have to, if somebody is showing a high temperature, you're going to have to move them out of the line and deal with them on a one-on-one basis. Right then, you've already betrayed their confidentiality. Every other employee in that conference room is going to watch, to be honest, because this is what normal human behavior is. They're going to be watching who's getting their temperature taken, and they're going to be watching who you take out of the line or out of the group and pull aside. So the current guidance is to do temperature taking, you should do it privately, within people's own offices or in a private space, so that it's not betraying anyone's confidentiality. So that's where you need to start thinking through the implications of temperature taking and go back to, what is the risk of my organization? Am I a high risk organization or a low risk organization? And is this a step that I need to employ to help my employees feel truly safe and healthy in my workplace? Another area that organizations need to think through is having a set of rules around visitor contact, or for those you serve. So how are you going to redirect visitor traffic through your workplace? Many of us have been in grocery stores in Sarasota County recently where we have to remember whether we're going up an aisle or down an aisle. It could look something like that. You may want to limit the number of visitors in any area at one time. You may want to put in a protocol that tells employees no handshake greetings and remain 3 to 6 feet apart from any visitors. You may want to continue to use video or telephone conferencing instead of in-person meetings, especially with those outside of your organization. And then to the degree you can provide contactless pickup and delivery of products, you know, whether you have water delivered to your location and you keep a water fountain in your location, you're going to want to figure out how to ensure those products can continue to be delivered without any contact. So those are just some tips and clues about defining some visitor contact rules. So let's spend a moment on remote work, So many of us, Almost all of us have been telecommuting, and it's proven to work well for some employers and for some employees. So now, as you're thinking about returning to work, it's a good time to consider, is it not only a short-term emergency tool, but is it also a more permanent work-life balance program and a cost-saving measure, both for you as an employer and for your employee? So some actions to consider right now are, to continue to allow remote work where possible to keep employees safe. If it's been working, there's some people that might say, why not? Why not keep remote work going if it's effective, productive, you're reaching your goals, you're achieving your mission? Another approach to consider is staggering weeks in office and at home amongst your team members, or doing part-time remote work on alternate weekdays. So instead of having if you have a staff of 20 employees, instead of having all 20 employees there Monday through Friday, or whatever your work week is, that maybe you only have 10 there one week and 10 the next week, or you do that in terms of days. Be flexible in responding to employee requests to continue to work from home. Be open-minded, lean into your flexibility, because this is both a way to keep your workplace a little bit more safer, keep the employee a little bit more safer, and longer term can end up being a cost-saving measure for you. Look at your technology. Do you have the right technology in place? Do you need to update it to support a virtual working environment? And then consider that there are some long-term cost savings of offering permanent remote work. One example I'll give is maybe you don't need as big a facility as you currently have, and you could downsize the facility, pay less rent, and at the same time provide employees with a better work-life balance. So kind of a win-win for both the employer and the employee. A lot's been said about social distancing, and I'm certain we're all practicing social distancing right now. Some other tips and clues about social distancing in the workplace. We've already chatted about staggered shifts and staggering things like lunch and rest breaks, rotating weeks in the office. It could be rotating days and working remotely. Some other tips and clues are moving your workstations to increase that separation distance. If you have a lunchroom or a room where people gather, you need to think about that. You need to think about your conference rooms and possibly blocking off chairs around the conference table. And then think about implementing a one-way or traffic pattern throughout your workplace. That could also be effective and get, people kind of navigating their way through your workplace in a more organized and focused kind of way, so they're not all just scattering when they arrive in your workplace. So those are some other tips and clues about social distancing in the workplace. So I want to pause here for a moment and talk about infectious disease policies. This kind of takes me back quite a ways. I was in an HR role, a senior HR role in banking, when AIDS and HIV came along. And we definitely scrambled in many ways. We had employees who were afraid to use phones, to touch doorknobs, and so on and so forth. I was also a senior HR person in 2009 when swine flu crossed our country, and it was also known as H1N1. And I would say it was kind of the tip of the iceberg of what we're seeing today. We started to do a lot of the employee practices about washing hands, about using disinfectants. We were establishing Purell stations everywhere in our locations. We were starting to develop policy around it when it died down and it went away. And you know what happened? And I kind of regret this. At that point in time, I think as organizations, we should have said, oh boy, we got a little bit lucky there. It didn't turn into a pandemic per se. It didn't turn into what we have today with COVID-19, I need to get my act together and I need to get a policy in place so that next time this happens, and there will be a next time, that we're not in the kind of the chaos and the emergency situation we were 6 to 8 weeks ago. So lessons learned, looking in hindsight, now is really the time. Let's get your policy house in order. Let's establish a policy for the future. Let's not, the next time this happens, be caught unaware and be caught doing emergency types of chaotic, practices and policies, because we have no choice. We can be in better control of what happens in the future. So as a result, Gulf Coast is providing, through me to you today, an infectious disease policy. And this will have features and guidelines around limiting travel, preventing the spread of infection in your workplace, some tips and guidelines on telecommuting and telework, staying home when ill. What do you do in terms of requesting medical information and then keeping that medical information confidential? What are your social distancing guidelines, and what are you going to employ in the future? What are you going to say to employees about their outside activities, including travel around the world, and so on? So I will spend a little bit of time toward the end of this webinar, as I committed, to review the policies and practices Gulf Coast is going to provide. But I would strongly advise every organization to take the opportunity to get your policy house in order and establish a policy for the future. We all went through a really tough 8 weeks. Your employees went through a really tough 8 weeks. Let's be more organized and more planful and more intentional about how we manage through this situation in the future. We've also provided some more policy support around the Family First Coronavirus Relief Act. Actually, my first webinar spent quite a bit of time on this. And even though that was only about 6 weeks ago, we've learned a lot more. We've gotten a lot more guidance and a lot more direction. So just as a reminder, the FFCRA was provided and voted into law for certain circumstances related to COVID-19. And these are for all employers, with a specific focus on those employers with 500 or less employees. You might recall that the Law for Family Medical Leave Act, or FMLA, is for employers with 50 or more employees. I think the vast majority of our nonprofits in our region are less than that. So you may not have paid any attention to the federal FMLA law, nor did you have to. I have run across several nonprofits that put some of that policy in place for their organization, but I've really not run across any smaller nonprofit that's adopted the whole FMLA. So some learning here to be done. This particular law provides for up to 2 weeks of sick leave, full pay for the individual employee, or 2/3 pay for family care for a certain set of circumstances. And then it also provides for up to 12 weeks of expanded FMLA under certain conditions as well. The effective date of the law was April 2nd of this past year, 2020, and it is scheduled to expire on December 31st, 2020. The law also required that there is a poster that every employer is supposed to place in their workplace in a common area where employees would see it. And we're providing you with a copy of that poster today as well. I mentioned earlier that OSHA was providing more direction and more guidance. There was a lot of chatter amongst a lot of the sites and a lot of the research and the reading I was doing that OSHA's been quiet. Well, lo and behold, they have developed a set of guidelines on making your workplace safe for employees to return to work. I really thought it was excellent. Now, it's very comprehensive because it covers workplaces that are very high risk, all the way to workplaces that are very low risk. So there's a lot of material in there and you kind of have to navigate your way through it, but I think it's worth your time to do so. And what I've done here is provide the link, the OSHA link to their publication called Guidance on Preparing Workplaces for COVID-19. I would strongly advise you to visit that publication, download it, print it out, read it, distribute it. All of us need to learn more and more on keeping our workplaces safe from communicable and infectious diseases. So again, I mentioned earlier that Gulf Coast is providing what I call a return to work toolkit, but policies and forms that I've mentioned throughout this webinar that will be available on the website. So in the infectious disease policy arena, in addition to a draft policy document, we're also providing a COVID employee health screening documentation, a COVID temperature taking protocol, a COVID return to work self-certification, and then a poster for you to use in your workplaces called Stop the Spread of Germs that really support those kind of basic steps that you want employees to take in your workplace. Secondly, we're providing a policy for the Families First Coronavirus Relief Act, FFCRA, and an emergency sick leave request form so that employees who want to request to take emergency sick leave, you have a process and a way to do that. An expanded FMLA request form, similar to the emergency sick leave, you have a process and a way to operationalize an employee request. And then the FFCRA required that every workplace post a poster in an area that is common to employees. So that will be part of this toolkit as well. Finally, last but not least, is the occupational risk pyramid and categories. Again, I was so happy to find that earlier on. I think I said that when I took you through what the pyramid looked like. This is a one page that I've downloaded from the OSHA site. It shows the actual pyramid and then it has all 4 categories on it. It is a great one-page document for you to take and to have a discussion with your board, your leadership team, your managers, your supervisors, your employees, whomever, and have a dialogue and a conversation about where do you fall on this pyramid. And that, I think, is the best way for you to help figure out what of these programs and practices you want to put in place going forward. Again, there are so many resources out there that I have taken the approach of relying on these specific ones. I think they're best practice, they're very reliable. I feel like I'm going straight to the right source of information, that it's factual and so on. So I am pretty exclusively using the Department of Labor, Centers for Disease Control, Society for Human Resource Management, and OSHA. And I would suggest that you all try to narrow the scope of your own research and reading to sites like this as well. I mentioned in one of my earlier webinars that SHRM, known as the Society for Human Resource Management, is actually providing the coronavirus toolkit free to non-members. So go on their website and take advantage of all the tools and articles that they have there to help you as well. Some other I3Digital sample offerings include financial tips for quarantine nonprofits, more information about the CARES Act, and certainly I know the vast majority of our organizations have wrestled through applying for PPP, the Payroll Protection Program, a webinar about governing from a distance, best practices for virtual meetings and board meetings. And then recently, there's been some really, really excellent webinars, part 1 and 2, about our own personal resilience and how we build that up. Invested in Incredible created I3Digital as a response to this COVID pandemic. Gulf Coast is committed to continuing to provide you with resources to navigate during this time. If you have any questions or would like to seek even more consulting advice, you can do so by emailing i3@gulfcoastcf.org. And for more information, visit www.gulfcoastcf.org/i3Digital. Thank you for joining me today. Really appreciate your time, and hope you're all staying healthy, you're all staying safe, and that you find this return to work toolkit helpful as you welcome your employees back into your workplaces. Thanks so much. Bye-bye.